Hi, I'm Dr. Apoorva Reddy from Phoenix Speciality Clinic, Bangalore. I'm a consultant in the field of fertility, endoscopy, and obstetrician in Jayanagar. We've been practicing in the field of fertility OBGYN for over 10 years now, and we've been fortunate enough to help over 10,000 couples in their dream to achieve pregnancy and eventually have a healthy child. At Phoenix Speciality Clinic, we believe in providing comprehensive healthcare for women. Right from teenagers having cycle-related irregularities or PCOS abnormalities to young adolescents who are seeking contraception or fertility-related issues, to young couples who are planning for pregnancy or even trying to delay their pregnancy plans for a while, to even elderly women who are having cycle-related or general health-related issues and trying to make sure that they have a healthy lifestyle. So right from teenagers to middle-aged women, to even elderly women, all women-related issues are taken care by us.
Is it a myth or a fact that IVF babies are not healthy?
This is a common question that we get, that are IVF babies any different from regular babies? And the only answer that I give them is, in case if you've had an IVF conception, neither the doctor who's treating you, nor the ultrasound specialist who is doing a scan, nor the pediatrician who is going to deliver your baby, none of them are going to differentiate or will be able to differentiate that the child is an IVF conception unless you tell them. So practically, there is no difference between an IVF conceived baby or a normal conceived baby after the conception is done. Understand that IVF or in vitro fertilization is only a process to get pregnant, and once you're pregnant, the pregnancy is going to be as similar as what you would have in a normal case.
Is it a myth or a fact that only infertile couple can do an IVF?
Doing any kind of fertility procedure enhances your time to pregnancy. For some couples, yes, it is true, who are suffering from infertility, they need to get the procedure done. But for others, it might as well be a choice too. For example, couples who are already married and who do not want to get pregnant in the near future, they can consider in vitro fertilization and consider freezing their embryos as an insurance for the future. Eventually, when they decide to plan for pregnancy, they can still continue to try naturally to get pregnant. And at that point, if they do face any issues, they can use these frozen embryos as a backup. So it is true that IVF is done for infertile couples, but it is also true that healthy couples also can opt for this procedure in order to increase or in order to reduce their time to pregnancy.
Is it a myth or a fact that a person can't do IVF after certain years?
Any fertility-related procedure, be it IUI or IVF, is associated with a success rate. That means that it is not 100% possible at all given times. In the same way, when we do an IVF for someone who's younger, the probability of them getting pregnant is going to be much higher as compared to doing it for someone who is much older. For example, a couple who is less than 30 have a much higher chance of getting pregnant in an IVF in the first attempt itself as compared to a couple getting beyond 40. So if you ask me that won't a couple beyond 40 be able to do an IVF? Yes, they can still do an IVF, but the possibility of conception is going to be much lesser as compared to a younger couple. Likewise, there are multiple health or medical related conditions which can increase or reduce the possibility of pregnancy even in an IVF. So please be aware about these conditions and don't be in the overconfidence that, okay, we do have a backup and we can get pregnant at any time using an IVF.
Is it a myth or a fact that IVF drugs can cause cancer?
In medical profession, we have a statement that says, first do no harm. Likewise, whenever we give any kind of fertility treatment or health enhancing medications, the main aim is to make sure that it is not going to affect your health adversely, either in short term or long term. The only complications or side effects that you can experience because of the IVF medications that you use are extremely short term, like bloating, gastritis, abdominal distension, and a little bit of dizziness. None of these medications are proven to have any long-term related issues, and cancer being the least of them. So you can be rest assured that no matter how many number of attempts you have performed even in an IVF, it will not increase your baseline risk of developing a cancer or a malignancy.
Is it a myth or a fact that IVF has less success rate?
When you're trying naturally, the probability of... Okay, let me do it again. Believe it or not, when you're trying naturally, the probability of getting pregnant each month for an absolutely healthy couple is only 5%. Even with a 5% probability, cumulatively over a year span, about 70 to 80% couples do get pregnant. Now, in an IVF, in choosing a right conditions, the possibility of getting pregnant every month is almost about 30 to 70% given the circumstances. So now you compare the probability of a 5% and even a 30 to 50% possibility in IVF. All I can say is no matter what the age is and no matter what your medical conditions are, the chances of getting pregnant through an IVF is definitely much higher as compared to a natural conception.
Is it a myth or a fact that IVF medications can cause pain?
Most women are extremely concerned about the fact that IVF is a very painful procedure and it's going to take them a lot. But honestly, the only discomfort or pain that we can experience are the injections or the shots that they have to take for a period of 10 to 14 days when they are undergoing a stimulation for IVF. These injections are exactly the same as how someone would take for diabetes in an insulin method. The needle prick that they have, the pain that they experience with these injections is lesser as compared to what we would do even for a regular blood investigation. The painful part, that is the egg pickup, which needs to be done, is done under complete anesthesia, so which again is going to be comfortable for them and they can as well get back to work also after the procedure is done. So it is an absolute myth that IVF is a painful procedure in a physical aspect. But yes, there are a whole lot of emotional aspects that are involved in IVF. And I see that once women get pregnant, they never complain about the number of injections that they have to take or the number of visits that they have to do to the doctor. When the emotional component of not getting pregnant is involved, every single shot that they have taken or every single minute that they have waited at a doctor's chamber is going to seem extremely traumatic and painful for them.
What is surrogacy and how does it help infertile couples?
We all know that uterus is one of the most important organs for a woman because this is going to be the home for a child for almost 9 months. Unfortunately, some women have abnormalities or difficulties in getting pregnant because of uterine-related issues. This can manifest either as a recurrent pregnancy loss wherein they experience multiple miscarriages, or for some women wherein the uterus doesn't implant the embryo itself despite repeated attempts. So for these women is when we consider offering surrogacy, wherein another woman who is healthy and fertile will offer her womb or uterus as a place of sanctum for her unborn child. So yes, surrogacy has been a big boon to a lot of infertile couples who've had fertility-related issues, especially that are related to the uterine factor.
How does PCOD affect pregnancy?
PCOS or polycystic ovarian syndrome affects as high as 10 to 20% of the current young generation or young adults. Now, the most important concern, even for girls who are as old as 18 when they come down, the question that they ask us is, will PCOS affect our future fertility possibility? So the answer is both yes and no. PCOS is a hormone-related abnormality which results in abnormalities with respect to ovulation, that is egg release. Because of this, we will not be able to time the fertile window for women when they are planning to get pregnant. Or sometimes, if the ovulation in itself doesn't happen, in that cycle, the probability of pregnancy is going to reduce significantly. So for these women, we offer medications or supplements which act as correction for these hormonal changes and help in establishing regular ovulation. Once PCOS is corrected, then pregnancy should be a very easy or a smooth outreach for all the women who have PCOS. So if you do have PCOS, please understand that it is important that you get these hormone abnormalities or variations corrected and then can very easily get pregnant and achieve that motherhood that you always wanted. I'm extremely happy to be associated with Medi-Talks because now, just like any other service, even an emergency ambulance service also is available just within 10 minutes reach all across Bangalore, and thanks to the great team of Medi-Talks. Not just this, but they are offering all medical services end to end for all the people that are there in Bangalore.